interesting conversation on strategic management. As you all know, today it's revised to 10 a.m. because of our programming and very special coverage events we have lined up for today, Saturday. Very interesting day, July 25th, 2020. We'll be looking at interesting decisions and discussions around leadership, strategy, and management. And we have joining us virtually via Zoom, all the way from the Federal Capital Territory, Mr. John Wesey, Strategy Management Consultant and CEO of Psyntech Nigeria Limited. Nice to have you, Mr. John Wesey.
Thank you, Otto. Another great privilege. I hope you guys are cool.
Yes. We're all trying to make sure that we stay safe. And before we move on, let's go on to the updates on the current confirmed cases of COVID-19 in Nigeria. At the moment, we have 39,539 cases in Nigeria, with 16,559 recoveries in the country. The deaths recorded at the moment are 845. The top states with the high cases are Lagos with 14,177, which remains the epicenter of the novel coronavirus in Nigeria. FCT Abuja, which has 3,437, and Oyo State in southwest Nigeria, which has 2,497. The states with the lowest cases, the top three are Taraba, 54, Cross River, 34, and Kogi State, 5. That's for Nigeria. And also at the global level, Nigeria's, in terms of global countries that have confirmed cases, is ranked 47, while in terms of deaths, Nigeria is ranked 46. The major spike cases across the globe are in US, Brazil, India, and Russia. Those 4 countries are major contributors to the global confirmed cases. South Africa, with over 400,000, is the highest in Africa, and also in the first 12 with high cases of COVID-19 index. In the course of this conversation, we'll also look at developments in institutions. There's been much of activities of probing for accountability and transparency in institutions across the country, from regional development commissions like the Niger-Delta Development Commission, and also the Economic Financial Crimes Commission and the National Social Insurance Trust Fund. Just another aspect of leadership, which is very important as we discuss. So, Mr. Wesey, you've seen the cases, the index, and this by next week, 29th of July 2020, we expect the federal government to take a decision after this easing of the lockdown phase elapses. What is your reaction to these statistics that we have at this point?
Thank you, Otto, and thank you, viewers. It is a great privilege for me to be on today's telecast again. I think, in terms of what Nigeria is doing, because we are doing more tests now, and because of the release of the lockdown, we are seeing an activity of the numbers that are increasing, as the case may be. Now, the global data you just shared with us is encouraging, but we want it to be better. Yeah. We have 47 unconfirmed cases, okay? We have 46 on deaths, all right? Good. Now, that's not bad for our population.
180 million.
Yes, that's whatever the number is. You get the point. That's not bad for our population. But be that as it may, we're also excited, one, because the NCDC and all the frontline health workers and the states, it tells you that they are doing lots of work to make sure that as a nation, we're able to trap this pandemic the best that we can within the available resources that we have. You also made mention of what is likely to happen after the next phase elapses next week. Like I told you, when we're also finishing a phase of the lockdown, recall I told you that government was going to open up the states, and that was because as at that time, we've been able to make sure that we are able to give our best. We've been able to give our best to this issue. And the data we had suggests that our authorities are having good control or good management to some extent. Now, what is going to happen next week? Government is going to look at the data before it across each of the states. How many are we having by road? In terms of new infections, what is the statistics of new infections that we have? Are they from indigenous or citizens resident in the states, or were they imported from other states to these states that we are seeing spike? If you look at the briefing of yesterday, Lagos was number 2. Which state was number 1? I think it was Oyo State.
Yeah.
Oyo State was number 1. So the information we do not have from that data that NCDC shared with us is that increase in Oyo State, was it imported? Or when I say imported, from people who came in as a result of what? The relaxation of the lockdown. Or was it as a result of tracking and tracing or increased testing by the states, as the case may be? So we need that information to guide us. Now, let us assume that those cases were imported. Will government now ask other institutions that have not fully opened, other businesses that have not fully opened, to now open? I cannot say immediately, because if the numbers are increasing, then something needs to be done. If you follow the news, we've heard a number of people who went to some convocation, all right, to some gathering recently. Yeah. They caught the COVID and they didn't waste time, they are gone. So that should tell us about congregation, about coming together. So what does this tell you? So you could see the religious bodies are all clamoring that churches should be open, but churches are opened in some,
and businesses are open.
And some businesses should be opened. Yeah. So I think so far, if I were a government, I would still say 1 week, we don't need 2 weeks, 1 week, let's see how we're able to gather enough data as per spread or increase on confirmed cases, death, as the case may be. You get my point. That's 1. 2, what is the rate of increase of testing that we are doing nationally? Do we have that data? We need to be able to know what is the rate of increase, or what's our current rate of tests nationally. Of course, like you know, we'll get that data from each of the subnationals. So when we have that data, we can use that to interact with our citizens for government to be able to make the appropriate decision. Are we doing well, Otto? Trust me, for all standards, Nigeria is doing very well. The campaign is good, although in the hinterlands, from my recent experience, in the hinterlands, they still believe it is the rich man's disease. In fact, if they know you are coming from Lagos to the hinterland, or you're coming from Abuja to the hinterland, your relatives will be avoiding you creatively.
Yes. So quickly, Mr. Wesey, just responding to your talk about tests. I remember there was a time in our conversations you used to lament that we were below 10,000. But currently, the sample tests carried out is 256,038, which alludes to the fact that the more we test, the more we can know the status of how people are either infected with it or those that are free from it. So yes, I think we're making progress. We need to still ramp up, like you said, opening up the space, which NCDC is doing, deepening it, using even private sector to ramp up the issue of tests, to scale it up. Lagos State Commissioner for Health, Professor Akin Abayomi, was also giving his concerns that this may peak even as they continue to push for ramping up of more tests. Looking at Lagos as the epicenter with over 14,000 cases, and also the concerns about if schools should reopen or not. So I know I'm bringing you to that conversation again. South Africa, that has the highest case in Africa, has now decided that they will close down schools because this has been spiking. What will be your, if you're in that position to recommend to government, would you say that they should still extend beyond even September reopening of schools? Some states are already embarking on schools reopening and carrying out their activities.
Otto, thank you. Again, where we see exemplary leadership, we must commend. Look at Oyo State government. You know, I keep telling people, we've got very smart people in Nigeria who are in their final years or who are taking critical lessons. Within, if these are implemented, Otto, my expectation is that governments can ask their
students. Okay.
Only those in final years resume today. Give it or take it. About 30% are going to offices. Now, the remaining 70 are public.
Yes.
No, large buildings, they may have.
People that attend the churches there.
If you